Can you have a flat transfer to the breast at the same time as a breast lift? Yes, you can. And people talk about this, and I go to meetings, and there's people who are kind of promoting this, and I'll be honest with you, I don't like it. I don't like it because I feel there's a bit of propaganda. I mean, there's a bit of propaganda. Oh, is propaganda the right word? There's a bit of marketing, I guess is the word. I think marketing is good. I've got no problem with marketing if you say that marketing is telling people what you can do and that you exist. But you've got to be careful not to inflate your what you can do, basically. And the reason that fat grafting at the time of breast lift exists as a thing is because one of the problems with breast lifts is that you put all the volume up high, up in the upper part of the breast when you first do a breast lift, and it settles, and you lose volume in the upper part of the breast, and you get sort of concavity in the upper pole. And I try and be clear about that to patients pre-op, that they're comfortable with the sort of shape that you can achieve with the breast lift. And something we're doing as surgeons, it was always trying to look for ways to give more sustained fullness in the upper pole of the breast. A lot of people think, I'm having a boob job. They associate a boob job with breast implants, which have much more stable fullness in the upper pole of the breast than you can get with a breast lift. And they have envisaged that they're going to look like that. And then they have the breast lift and they don't look like that because it settles to what I would always say is a more natural shape. But sometimes if you're having a breast lift, you have in the mind that you're going to have them lifted and they're going to be really high and they're going to look really pert, whereas they may not look as pert as you had hoped if you don't have realistic expectations. So a lot of the job is about managing those expectations. And then some people have said, look, we struggle to get the fullness to stay in the upper part of breast. How about we do some fat grafting to give more fullness into the upper part of the breast, which sounds good in principle. The two reasons to do fat grafting will be, one, to give the better shape, to give more fullness to the upper part, and two, to give a bit more volume. Now, I've already spoken about in the past about the fat grafting and volume. It's in my hands anyway. It doesn't give a huge amount of volume, so that's not. I feel that that's not a huge benefit of it. One of the downsides of fat grafting is it is quite expensive. So if you're not getting a huge result from it, then I feel that it's not worth it in my hands. I mean, I'm not saying it's not worth it full stop, but I think that personally, I don't think that the fat will stay in the upper pole, just like when you first do the breast lift, all the tissues in the upper pole, and there's a lot of fullness in the upper pole, and then it settles. So I personally feel that it will settle in the same way that the fat that's in the breast will settle. And so I don't think it will give sustained fullness in the upper pole of the breast. And the reason people can do it is that if you don't know what it's going to look like, and if you kind of believe that it's going to look better, and certainly if you paid more, you might be more invested in it being better, you might think, oh, that's a great result. But I'm not sure if there's anyone who's tried to be kind of scientific about it to say that whether it can give you sustained fullness in the upper pole. So the fullness is always there to start off with, but does it stay there more if you combine a breast lift with fat graft than if you just did a breast lift without fat grafting? And I'm not convinced about that, but maybe some people are. But so in my view, it's something that needs a lot more careful thought and discussion than it might first sound when you say, yeah, I'll have a breast lift, and do you want a bit more volume, a bit more fullness in the upper pole? We'll do a bit of fat grafting. Sounds great, costs quite a bit more, and as I say, in my hands, doesn't really give much more. And the reason I say it is because I've done it, and it hasn't been as impressive as I had hoped. I think the patients have been fine, to be honest, but it's not quite as, because they don't know. You don't know what the breast lift's going to look like. So a breast lift is quite it's a good operation. It gives a great transformation in the shape of the breast. So you don't know how much extra you're getting from the fat graft because you're having it at the same time. So yeah, it's not one really for me, but or at least not without a lot of careful discussion and realistic expectations. But it's certainly out there in the world, so you can have it done. But I don't need to do breast lifts at all anymore, to be honest with you. I'm just supporting the other guys in the clinic now. rather than doing these myself. But yeah, I wouldn't be pushing for fat grafting at the same time as breast lift. At the moment, if fat grafting evolves, and I think it is evolving, and we're trying to do bigger volumes, there might be an argument then. If you can get more volume there, then there's more of an argument that you want a bigger breast, then maybe. But as I say, at the moment, as in my hands, it's not huge volume, so you don't get a significantly bigger breast, so that's not really a reason to do it.